Hey everybody, Dr. Todd from Gonstead Spine and Wellness. In this video, I want to talk about why we do traction. So I'm holding a spine here in front because before I can even talk about why we have all this equipment and why it's so necessary to help fix our patient's spine, get our community super strong, is you have to understand what normal is. There is a normal curve and alignment of the spine just like there's a normal blood pressure. Okay, normal blood pressure is 120 over 80. If your blood pressure is 125 over 85, no one cares, right? If it's 200 over 100, that's a problem, and someone needs to intervene to bring the blood pressure down, or there's going to be major consequences. Same thing with the spine. On the side view, things are supposed to line up, okay? The ear, the shoulder, the hip, the knee, the ankle on the side view. And then there's curves that are supposed to exist in the spine throughout that alignment. A forward curve in the neck, a backward curve in the mid-back, a forward curve in the low back. Not too much, not too little. And all those numbers and measurements, that's something that we actually measure and keep track of very carefully to see if someone falls within those norms. Just like that blood pressure analogy, there's normals in the spine. So if it's a couple degrees off or it's shifted a little bit, no big deal. But when someone comes in and they have this huge curve in their mid-back like this, and their head is jutted out forward like this, that's something that we pay attention to. And so here's where traction comes into play. Now, in previous videos, we talk about segment, posture, movement. We talk about how we look at the individual segments of the spine. We look at postural shifts. We look at movement patterns. But really, when someone has an abnormal posture, there's other causes of this. But now, how do we fix it, okay? So in some cases, if someone's flexible, we can teach them corrective exercises along with adjusting individual segments of the spine to be able to get them into an upright position or a neutral position. Another thing I didn't mention is posture is also looked at on this front view. The head can be shifted side to side. The rib cage can be shifted side to side. There can be a bend and a twist called a scoliosis. Those are abnormal postural shifts on the front view. So it can be on the front and the side. So now with that said, if someone's limber, if the problem hasn't been there for a long time, sometimes in younger patients, we can just, again, adjust them and teach postural corrective exercises, and we can get these things to change. But in a lot of cases, if someone's been in that position for any extent of time, they need a little bit more help. And the help is traction. So traction is now holding that person in an exact opposite position with some force, pushing them further with more force than they'd be able to do on their own in a corrective exercise, for example. So let's just use this example of a shift in the rib cage. If someone shifted like this, and it's a brand new thing, and they're young, and maybe they had a problem with a certain joint in the spine that was causing pressure on the nerve, and it caused them to shift to begin with, we can get pressure off of a nerve, fix that joint, maybe they start coming back over, then we can teach them some exercises to shift in the opposite direction, start equalizing out muscle control, and then maybe everything's fine. But in a lot of cases, when someone's been like that for a prolonged period, we can do all of that and it never quite takes them back even to neutral. They're still stuck in that position because deep muscle and ligament has remodeled, it's deformed into that abnormal posture. So the way that we fix that type of issue is now we have to do traction, meaning now we have to pull them into that opposite direction and hold them in that position for 15 to 20 minutes. So this equipment is made exactly for that. We can set people up in there. These all have different ways that we adjust the equipment to change different angles and pulls based on coordinates that we get on the x-ray. So x-ray is super important to figure out A, are you a candidate for this, and B, what's the best setup to make this super effective. So in the case where someone shifted over to the left, we could sit them down here, put different straps and things in there, and then gently and carefully pull them from left to right. And we can do that incrementally. So each visit, we can pull them a little bit further. We have them do things at home in between visits. And over the course of typically a couple of months, we can take something that took years or even decades to accrue, and we can get measurable changes in as little as a couple of months. So it's pretty phenomenal stuff as far as transforming and fixing someone's just visual posture, but also their overall health. Because when your posture and your spine and your movement patterns are all within a certain limit of normal, you function better. When you function better, you're healthier. So it's a pretty cool relationship of how the spine and the posture really affects your overall health. So I hope this brief video talks about the importance of traction, why we use this, and why you should seek out someone that does this type of technique, along with a very specific approach to looking at the segments of the spine, and also someone that analyzes movement. So with that said, if you're suffering from something and you haven't been able to find a solution to your problem, this might be something that can help you. So if you have any sort of questions, feel free to give us a call, and we'd be happy to let you know if you're a candidate for this or any other types of care that we offer to fix your spine, your posture, and get you healthy. Hey everybody, Dr. Todd here.
And Dr. Omar.
And if you like what you just saw, please subscribe to our channel.
Or share this information with someone you think would benefit from this.
And click the link below. Make sure you do that. And? And what?
That's it.
And we'll see you on the next video.
Yes.
And?
That's it. Have a great day.
Or night, because you don't know if it's daytime or nighttime you're watching this.
Very
anyway,
true.
We'll see you in the next video.